Hello, welcome to another beautiful day on our platform. It's all about health management. It's all about taking care of yourself. And how have you been? I believe from our last time meeting to now, you've been taking good care of yourself because health per se is wealth. My name is Lucy Erickson Ochinoko. Welcome to another beautiful day on your health, a program that brings health management and season personal for your understanding and for your management of your health. Welcome to another day. Okay, today we have Dr. Bobolaja who is a consultant pediatric neurologist. I hope that's it. Pediatric neurologist in the house. Yes, and Dr. Teresa, good to have you in the house. You're
Thank you.
welcome, ma'am.
Thank you very much. Thank you for having me here.
By the way, you're looking good.
Thank you so much, ma'am.
Okay, when the word pediatric comes, we know it's all about children,
Yes, ma'am.
0 to 5 or above.
Children are people are less than 18 years.
Okay, so 0 to the 10.
Yes, to
Okay,
17.
the 17
Yes,
children.
yes,
Okay, so you manage us from infancy to acting age.
yes, ma'am.
Okay, all right. So today we'll be looking at epilepsy in children. But before that, we'll be wanting our consultant in the house, Dr. Teresa, to give us first an overview of that brain disorder, the epilepsy.
Thank you, ma'am. Thank you.
Just leave the mark.
Okay. Okay, so in talking about epilepsy, first and foremost, we would like to define what epilepsy is. Now, epilepsy, permit me to define seizures because it's going to relate to epilepsy. Seizures is defined as a situation where you have abnormal electrical activity to the brain. When there's abnormal electrical activity to the brain, it releases some discharges that can manifest as motor, psychic, autonomic, and sensory symptoms. What do I mean by that? Motor, there's abnormal movements of the body. The person moves his or her body, what people normally know as convulsions. You also have sensory, where the person's taste or smell will change. And then psychic, the person will have feeling of, of not being in a familiar place. And autonomic, sometimes they'll sweat or they'll begin to feel their heartbeat. These are features of seizures. Now, epilepsy is recurrent seizures. Yes, when a seizure has occurred more than once, greater than a 24-hour duration, that is epilepsy. A lot of people think that epilepsy is the big abnormality. When you tell them, they'll say, my child convulsed, he doesn't have epilepsy.
Okay.
They don't know that
Okay.
once it has occurred more than
More than
once, after a 24-hour period, that child already has epilepsy. Okay. So now that we're talking about this, recently there was celebration on March 26th for International Epilepsy Day, and the theme was Stand Up for Seizures. So to stand up for seizures. So having said this now, epilepsy is quite common. If you take 1,000 children, up to say 8 to about 20 of them will have epilepsy. So it's quite common. And then we want to look at the causes of epilepsy. Now, looking at the causes of epilepsy, there are so many causes. We look at what is called structural causes. What that means is that there's an abnormality in the brain. For example, when children that have tumors, children that their brain didn't form properly or didn't develop properly, what is called like lysencephaly. They have smooth brain. Their brain didn't have that normal depression, what is called sulca and gyra. So when there's any abnormality in the brain, the child is prone to having seizures. Other causes that can occur include metabolic causes, when there's some problems with your metabolism, what is called inborn errors of metabolism. Those children can come down with seizures. Immune causes, like some kind of inflammation of the brain, Ramsay's encephalitis. And then there's this common popular one we all know. At birth, children that are born that don't cry, what is called severe birth asphyxia. We also have neonatal jaundice, because the brain is immature then. You understand? So there's brain damage. Those children can come down with epilepsy. There are also genetic causes. You
What
know,
did you call that thing? Infant
genetic
what? No, the
causes.
infant one.
The which of them?
The one for the neonatal. What?
Okay, severe beta asphyxia,
Okay.
neonatal jaundice,
Okay.
or any infection. We also have infections, like when there's infection of the brain, the covering of the brain called meningitis. When it occurs at a very young age, is not properly treated, or there are complications, what is called post-meningitic sequelae. Those children can come down with epilepsy, seizures, and then epilepsy. Okay, and so many other causes. But there are sometimes you can't even trace the cause. You know.
Oh, some causes are not traceable.
Yes, the child was giving birth to normally. There's no problem. There's no family history. There's nothing, and then the child just has epilepsy. That's called idiopathic cause.
Idiopathic.
Yes.
So in Nigeria, we call that one hereditary. Because there is no cause now.
Yes.
No medical, no
you can't really
reason
find
for
out
that.
the
Yes.
cause of that.
At this time, we say it's not spiritual, but you call it the idiopathic.
Yes, ma'am.
Okay. Okay, it's all right. Now, following you mentioned a whole of causes, anything that could actually lead one to have this epilepsy. You talked about abnormality in infancy, the neonatal jaundice, and the rest of it, and now the untraceable cause. Okay, now when we talk about all these singles in children, how will a child who has just been given birth to, or say between the age of 0 to 5, and have never convulsed before, and then suddenly start having this seizure, what is that sign that will let the parents or the caregivers know that this is not just a convulsion? What's that pointer that this child might be epileptic?
Okay, as I said, epilepsy is recurrent seizures, and seizures can manifest in motor, sensory, psychic, or autonomic. So what you can see in a child, for example, is the first classical one, which we all know, that's the convulsion. The child begins to stretch.
Okay.
That's tonic. The child first of all stretch and then begin to move the body in a rapid manner. That's the common one we see. Another thing you can see is that there's uprolling of the eyes. You just see the whites of the eyes in the child. The eyes goes up. That child can urinate on him or herself, or they can stool on themselves. This is the common classical type, the generalized seizure that we usually see. Okay. Now there are some other types that involve, a part of the brain, and you just see the child turning to one side, turning to one side, just like that. That's another seizure. Or it starts from one hand, and you just notice that the child turns to one side. Another symptom you can see in them is that the child just stares, absent-minded. Yes, the child is just, maybe for example, in school, children, they are teaching, and then suddenly you just notice that the child is staring. Then you call the child doesn't respond. After some time, the child picks up and continue what he or she is doing. That's called like an absent seizure. So these are some of the common ones.
At that point, would they say the brain right now, at that between that space mid, is like turned off, relaxed, or it's not functioning, or what?
Okay. So just as they have different types of seizures, they have different affectation. Sometimes some of these seizures, consciousness is lost. The person is not aware. Those classical, like the generalized seizure that affects both parts of the brain, the person loses consciousness until the event is over. However, there are some types that the child is actually aware, what is called focal aware seizures. They will even tell you where seizures. Yes, the child will say, "Mommy, mommy, mommy." The child just starts shouting, and the child is aware of that seizure. The hand or the face, whatever, you see that they can feel it, like an aura, like they can perceive it or smell it, and they'll tell you they are aware. So those are the two broad classifications. They can be aware sometimes, and sometimes
they can.
they won't be aware.
Okay. So now, we've been talking about, if you're just joining us, is the program Your Health, and we're looking at epilepsy in children today. I have a Dr. Obulaja Teresa, consultant pediatrician, the pediatric neurologist in the house, and we're looking at epilepsy in children. She's talked about so much, and when we talk about the zero, especially the 0 to 5, more attention needs to be paid to these children. Now look at the scenario she just said that a child could just be in the class or probably is with you in a family setting, and suddenly this child just lose focus, is just staring at a point, is not aware of what's happening. It takes some minutes. At least if you notice this occurrence more often, you should know that your child probably is undergoing epilepsy even without the jerkings. So we need to be very, very careful and around our children, the caregivers, parents, or even our family members. All right, then, Dr. Teresa, let's look at treatment. Or is it time for a break now? Okay, so we're still on the program Your Health, and we're looking at. So now let's talk about treatment and safety measures, because you know the children 0 to 5, especially, these are really my measurement. Yeah, 0 to 5. These are very active children. These preschoolers, pre-get graders. Before you just say, hey, they're up to something. Now, what are safety measures to be employed, or treatment measures to be employed when a child has been diagnosed of epilepsy? And for the non-diagnosed ones, what should caregivers do after the given diagnosis?
Thank you so much for that question, because it's very important. Now, when your child has epilepsy, recurrent seizures, first and foremost, we should notify the school proprietors, notify the teachers, so that just in case, he has that seizure in class, they won't be so surprised,
Right.
and then they know what to do. Thereafter, when a child has the seizure is actively convulsing, the first thing you should do is to lay the child down on the left lateral position, so that things don't go into the airway where
Okay,
the
like
child is
lying
breathing.
over the side.
Yes, on the side, on
Okay.
the left side.
Left
Particular-
side.
Yes, ma'am.
Okay.
Left side, the child lies down. So you place the child that way. Then you make sure that the child's not wearing any tight clothing. If the
Okay.
clothes are tight, you try to loosen the clothing of the child. And then over time, as the child is convulsing, most likely that convulsion will stop. However, there are some situations where it may not stop. When you have, say, 1 to 2 minutes, that child is actively convulsing and has not stopped. Please, you need to take that child immediately to the hospital.
Okay, so once it exceeds a minute or two,
Yes,
you need a professional attendance.
Yes.
Okay.
Child.
Okay, so that's for treatment.
Yes.
Okay, for safety measures. Okay, that's treatment through safety now.
Safety measure.
Okay. Now, professionally, as a neurologist, um, what treatment do you do? Like now, do we just do you give like injections or tablets or anything? Um,
For the child.
yes, to help.
Treating these children, the first thing before we actually start our treatment is that we counsel the parents, we talk to them. These children, they are small, and so they're under the care of the parents. They are not supposed to miss medication. So we give medications. There are drugs that these children take that actually help to stop the seizures that the child is having. And so they have to be faithful in taking this drug. It's not easy to take a drug every day, and to ensure that it's given at the right time and at the right dose. So there are drugs that can be given. There are dietary measures. When drugs are failed, there are dietary measures called the ketogenic diet, but by then you must have tried drugs, first line, second line. Then there's room for surgery.
Okay, I will pause you here, Dr. Obulaja. When we come back, a break beckons now. When we come back, we'll continue from that point. All right. You're still the program, Your Health. You want to use this time out to say thank you so much to the Nigerian Medical Association, Sabazon, for graciously always loaning us professionals, health professionals. Today we have our consultant, pediatrician, neurologist, and the health Dr. Obolaja Teresa. We'll take a break. We'll be right back. All right, good to have you back on our program. We're looking at epilepsy in children. Earlier, we've been talking with our guest today, Dr. Olaja Teresa, consultant pediatric neurologist, and she's been taking us in a whole lot of things that we need to know about being epileptic. It's just a thin line between convulsion and epilepsy. She said that when that seizure, that convulsion has exceeded the timeline of 24 hours, you need to actually check this child out and have this child properly diagnosed. And if it's epilepsy, the cure or the treatment and management will be outlined for you. All right, so talking about, we went on break while we're talking about treatment and probably management.
So as I was saying, for the treatment, there are drugs you can take. There are tablet syrups that can be given to these children. Aside those drugs, we also have dietary measures. When drugs have failed, sometimes these seizures or convulsions can be so bad that sometimes they don't even respond to drugs. Well, that's not a frequent thing. Yes, not so frequent, but sometimes you have very serious seizures. You can now go to dietary measures. There is what we call vagal nerve stimulation, where they will stimulate a nerve, or deep brain stimulation, where they will stimulate the brain, those centers that are responsible.
Such things, is it available for us here? Are you talking about the ones overseas or here?
Well, a few are available, like in Lagos.
If I have an epileptic child in Asaba, how do I assess that kind of treatment? And is it affordable?
Well, as I said earlier, having seizures that are not, don't respond to drugs, before you certify that a child is not responding to drugs, you must have gone to the maximum dose. You must have tried, first, second, there are several drugs you try before you are comfortable to say, okay, this child didn't respond to the medications, and then I want to use diet, which is the next. And we have a dietitian, Federal Medical Center that can give you the ketogenic diet. It is when that has failed,
you now begin to talk about the advanced treatment. Okay, now let's look at this scenario. A child, because we talked about some being aware of their seizures, and now the school is aware. But in a society, we live in a society where people are very spiritual. Now, we also mentioned that some epilepsy do not have known causes, and that people begin to look at the spiritual angle. We now abandon the medications the doctor had outlined for this child, even abandon the ketogenic diet. Now they begin to move the child from one spiritualist to the other. How do you look at this? Because oftentimes that we live in a spiritual society.
That's very, very wrong. Even in the Bible, when Jesus healed the lepers, he said, go and show yourself to the priest. After healing them on their way, they became healed. So there are things that are necessary. I'm not disputing the spiritual aspect. You can pray that your child gets cured. But you must take the drugs that have been prescribed for your child. You are watching your child is getting worse. You are going to church, you are praying. And for every seizure that occurs, the brain gets damaged because it's an abnormal electrical activity on the brain. and it's happening frequently, you don't take anything to stop it frequently, over time, it begins to affect the brain and different parts of the brain that are responsible for different functions. So, in as much as you want to go to church and pray, take your medications, treat
Okay.
your child. You say it's a spiritual matter, you leave that child. You know, there are some cases I see in the hospital and I'm amazed. You know, the child has had these seizures for 5 years. And they left the child and saying it's a spiritual matter. It's not fair on the child.
It's not fair on the child, and it's not fair for anyone when we abandon what we're supposed to do as parents and begin to just focus on the spiritual life. For every health challenge, there is always a medical angle or channel to it. If you do the medical, you can also add up the spiritual. Do not do one and abandon the other for the safety of our children. Now, a situation where there is no known cause is in the school proprietaries have been informed, the class teachers or caregivers have been informed, this child is epileptic. And now the children are on break, they are playing, not so close to the caregiver, and suddenly this child starts shaking. You know, the first thing that comes to people, especially when they see those film coming out from the mouth, they just run away. I heard so many things about being epileptic until like few years I know that those things they tell you that if you cross someone who has epilepsy, you become epileptic. You get close, the film coming from the person's mouth touches you, or the slime coming, the draws touches you, you become epileptic. So how do we break down those societal misconceptions of epilepsy?
Thank you very much. That's a very important and big one in our society today. There's a lot of myths and misconception as regards epilepsy. First and foremost, epilepsy is not contagious. You can't touch somebody that is convulsing and then you have it. That's
It's
not
not
how
COVID.
it's not possible, it's not contagious. So please, when you see someone convulsing, what you should do is to help that particular child. You understand?
Help by how?
Help by placing the child, as I said earlier, on the left lateral position, making sure that the clothing are not tight. You understand? The other things that parents or teachers do when a child is convulsing, they feel that when you get spoon to prevent, once you can prevent the tongue, you know those things have caused more damage, so much harm. You can do that, you can end up causing, yes, harm on the tongue. You can do that if you are not careful. You dislodge it, the tooth, it goes to the place where the child is breathing, and the child can pass out from there. The child
From being helped to
from trying to struggle and put a spoon or any form of material, all those things they don't help. Some people get oil,
yes.
they'll rub it on the child, they'll put it in the child's mouth. That child can go through where the child is breathing, the child can aspirate and die. Some people will put onions in the eyes, you know, when the child is convulsing. Those things, they don't help.
Those things don't help.
They don't help at all. You can even damage, you can cause blindness.
So the only thing we just need to do, if we're not professional, is just lie this child on the left
lateral
side. The left hand, that your English is heavy.
Okay,
left hand
left,
side.
okay, left
yeah, just
side.
lie the person on the left
hand
side, okay?
Yes.
And leave the person.
Remove any, if the
any
dress
ties,
is tight, you know, just free the child, and most of the time those things will stop. But if it gets to 1 minute, 2 minutes, you know that most likely
You
it's
need
going
a
to last
professional.
years. You carry that child to the hospital.
Okay, the time is no longer our friend here. Now let's quickly look at lifestyle changes and of course any other management advice you give us.
For lifestyle changes, there are seizures, epilepsy that we call photosensitive. If you watch TV sometimes, you know, they'll write it on the telly. This image contains photosensitive light.
Yes.
And so triggers so much light, so much exposure. So when you have a child that has epilepsy, as much as you can, you know, reduce screen time and bright light on the child. That's one. Two, let them sleep in time. You know, children these days, they'll be playing with their phone
Mm.
till it's late. And you as a parent, you don't even know that your child is playing games till late, 12, 1. That child is playing. That child will sleep well, wake up early and start preparing for school. So ensure that that child is, you know,
Have enough sleep.
yes, have enough sleep.
Okay.
Yes, in those children. And then make sure that, you know, that they take their medications. And then,
Seriously.
yes.
Thank you so much. If you're just coming in, joining us, it's really the wrong time to join us now because we're about to take our leave now. But we say thank you to Dr. Obolaje Teresa, consultant, pediatric neurologist in the house today. Thank you
Thank
so
you so
much.
much for
I've
having
learned
me
so
here.
much, and I know that our audience have also learned so much. One takeaway: if you see a child convulsing, please do not try to insert anything in the child's mouth. All you need to do, or even the onion or the oil, just lie this child on the left side of the body so that this child can actually, after some time, if it's tough, if not, the next point is quickly get a medical professional advice or help for your child. And then always know that your child needs to have enough rest. Enough rest cannot be just um, any prescription. In fact, everybody needs enough sleep so that the brain can actually relax. Remember that epilepsy is a disorder position of the brain. I also want to say thank you so much to Nigerian Medical Association and Sabazone for being there for us. And thank you once again to Dr.
Thank you
Teresa.
very much.
On that note, I say thank you so much to my producer, Alera Idramuda, and everyone here in the house. Until we meet again, take care of yourself and avoid whatever you can avoid. Eat well, drink clean water, exercise, and rest. Enough rest. Until then, my name is Lucy Ericsi Ochinago. Have yourself a blessed day.